Canada's health minister, who is supposed to be entrusted with safeguarding public health, has spread reckless misinformation in response to inquiries about low COVID-19 booster uptake in Canada, which means that the very authority that is appointing itself to regulate information and censor misinformation is, well, a source of it. Tamara Ugolini here with Rebel News to share a clip with you of Federal Minister of Health, that's Mark Holland, encouraging all Canadians to receive the latest COVID-19 booster formulations, referring to them as a miracle of science that have saved tens of millions of lives, before concluding that they're not only protective against the latest variants, but also that we should all concede that the novel injections still in clinical trials are remarkably safe.
I really want to encourage all Canadians. I'm going to be going and getting my own vaccination tomorrow, and I think it's incredibly important that everybody gets this. This isn't a partisan issue. It is a miracle of science that we were able to find the vaccines that have saved tens of millions of lives across the planet, including hundreds and hundreds of thousands of lives here in Canada. So I really want to compel people, the new formulation that protects you against the latest variants of COVID, go get the opportunity to get that shot. It's so important, not just for an individual, but also to make sure that we don't wind up in a situation where our hospitals get overwhelmed. So let's take that action collectively, and I really hope that this can be an area where we can all agree, both to be grateful for the incredible science that brought us these vaccines, but also come together and say they're remarkably safe. We've seen hundreds of millions of doses around the world, and we've seen the positive impact that has. So I hope everybody gets their shot.
All right, so first and foremost, according to Canada's own regulatory decision for the latest Moderna Spikevax authorization, these new formulations are still undergoing safety and efficacy assessments through clinical trials. Here, have a look. The safety, reactogenicity, and immunogenicity of Spikevax XBB.1.5 are evaluated in an ongoing Phase 2/3 open-label study in participants 18 years of age and older. It's study mRNA-1273-P205, Part J. And if you go to the clinical trial website through the National Institutes of Health, that's the NIH, you'll find that the study isn't even estimated to be completed until later this month, on November 17th. So who knows when that data will be publicly available? It's not even available to Minister Holland yet. And then that leads the question, how does he make such clear assertions if the clinical trial itself to determine the safety and efficacy of these new mRNA formulations remain ongoing? If that weren't enough, Minister Holland also spouts the ridiculous notion that millions of lives were saved internationally through the use of these novel biological products. This came from an imaginary scenario as modeled by Watson et al. Titled Global Impact of the First Year of COVID-19 Vaccination, the mathematical modeling study was first published in the Lancet Infectious Diseases in September of 2022. The findings themselves say that based on official reported COVID-19 deaths, they estimated that vaccinations prevented 14.4 million deaths, which rose to 19.8 million deaths from COVID-19 averted when they used excess deaths as an estimate of the true extent of the pandemic. Unsurprisingly, the modeling study was funded entirely by vaccine propagating organizations that profit from their use. Cue conflict of interest. Funding. The Schmidt Science Fellowship in partnership with the Rhodes Trust. They began a project in 2022 to promote COVID-19 vaccine acceptance and uptake in South Africa. The WHO, the World Health Organization, need I say more? They're leveraging total biomedical surveillance through the use of global digital health certificates. They called digital COVID-19 tests and vaccine passports a key tool in reopening economies throughout the COVID pandemic. The WHO calls itself the directing and coordinating authority on international health work that is responsible for defining overall guidance for such certificates. They even published a 99-page guidance document in August of 2021 that was used by governments to follow and implement the Orwellian and medical apartheid creating vaccine passport systems. The vaccine alliance, known as Bill Gates' pet project Gavi, which partners with Pfizer to ensure everyone in the third world has access to fresh drinking water, clean sanitation, and wholesome food. Wait, no, they actually don't do any of that. Instead, they make sure vaccines are available to infants and children in least developed countries. And another funder on there is the Bill and Melinda Gates Foundation, which funds all of the above. And then as well, the National Institutes for Health Research and Community Jamil. As pointed out by Denis Rancoir and Joseph Hickey in their debunking of this modeling, wherein they use real-world quantitative data, the entire basis of this claim by Watson et al. Is junk science. They dissected Watson's modeling parameters and compared them with actual all-cause mortality and excess mortality data dating back to 2018. They then cross-referenced that with COVID-19 injection rollout data. They calculated the quantitative consequences of Watson et al.'s theoretical scenario on all-cause mortality in the same 95 countries. They called Watson's low-value scenario palpably absurd. Here, look at their report, figure 2 on page 9, which is Canada-specific data. It depicts a disproportionate and massive national excess in all-cause mortality that would have tripled actual all-cause mortality during the first year of the vaccine rollout, and, oddly enough, not at all before. Specifically, that second graph, the dark blue line is actual excess all-cause mortality from 2018 to 2022. The red line is excess mortality plus the deaths apparently averted by vaccination if Watson's modeling is followed, and that's all contrasted by the gray line, which is the cumulative number of COVID-19 doses given. It shows that there is no significant changes in all-cause mortality following the World Health Organization's declaration of a deadly global pandemic in March of 2020, and instead of confirming Watson's modeling, it shows a proportional rise in excess mortality linked to the vaccine rollouts, counteracting the notion that the vaccine led to any sort of decrease in mortality, and certainly questions the validity of the notion that it had any meaningful contribution to lives saved. They found the same thing happened in the United States, in Europe, Finland, Norway, Qatar, Singapore, etc. These are not anomalies. Hickey and Rancoir conclude that their calculations provide graphical proof that the theoretical proposals of Watson et al., corresponding globally to 14.4 or 19.8 million lives saved by COVID-19 vaccination, are untenable and are not even partially correct. They call the Watson et al. Scenario incompatible with reality and criticize the legacy journal peer review system as being scientifically illiterate. And yet the legacy media reinforce these claims with their reporting that the COVID-19 vaccines saved millions and tens of millions of lives worldwide. This was all further reinforced by the awarding of the Nobel Prize in Medicine to the scientists who developed the messenger RNA platform. And this is all being regurgitated unabated by Health Minister Holland, who's responsible for overseeing health-focused government agencies and, of course, advising on policy and perspectives. Minister Holland can spread misinformation unrestricted because in Canada, we have a bought and paid for legacy media that dare not question the powers that be, since they are also the hands that feed. This is a minister from the same Liberal government that is keen to censor and moderate and regulate what you can find online, deeming anyone who questions the consensus as dangerous conspiracy theorists with unacceptable views. For Rebel News, I'm Tamara Ugolini. Let Minister Holland know that you want market authorization for these novel injections revoked at nomoreshots.ca. You can sign our petition, send to Minister Holland an email, and support our ongoing investigation at nomoreshots.ca. Thanks for your support.